A very warm good morning to you all. Thank you very much for making it today. My name is Keivan Ahmadi. I'm a senior lecturer at the University of Lincoln School of Pharmacy. Are we able to engage the ones who don't want to be engaged with the condition by creating something interactive, by creating something that goes above and beyond of traditional way of saying, this is the condition you have, these are your medications, this is the lifestyle you need to have, this is all imperative, you must, you should do it. There is a condition, there are problems with the management, however, what are the main barriers? Let's hear it from those who are dealing with the condition firsthand. And one of the ways that I thought it would be interesting to work with and have a discussion with other colleagues who are not here was application of forum theatre. And we are lucky to have Terry from Co-op Cities in London.
And it's no good saying to people, you must prioritise your health, because actually, unless we understand what the challenges are and why people aren't engaging and getting that dialogue going, as you say, it's not going to work. We're using a form of theatre, forum theatre, to look at some of the challenges, barriers and misconceptions around homelessness at that time. And we've been going for 25 years. We now use it in a huge range of settings, but mostly community settings, looking at issues. There's this empathy with the character because we see ourselves, or we see friends, or we see family members. That will be the element that will provoke the audience to get up. And we watch the story through that character's eyes. And we ask our audience to watch and think about what they might have done differently at any point of the story.
So it's one of my biggest interests, let's say, to try to explore the new ways and techniques to engage the patients, patients with diabetes in their treatment, how to convince them with the treatments and how to make them the center of the treatment, so they can be more actively participated in the treatment process.
If you know someone who's diabetic, generally you know to feed them and what to feed them, and then, they recover. It's not always as dramatic as a coma and going to hospital. Yeah. It should be fairly manageable. So it could be, if within that scene, it happens, the boy realises that he doesn't know anything about it.
He doesn't know about that, he doesn't know about himself.
Yeah, the other boy comes back and says, no, it's not this is normal, but it's okay, this is what you do. And then that's the moment of realisation that he then thinks, I don't want that to happen to me, or how can I prevent it happening to me? What can I do? Yes.
But she has read up a lot about diabetes and trying to nag her parents to actually obey the rules. So lo and behold, here we are, the scenery is watching TV at evening meal. So lo and behold, they're having fast food, they're watching the television, and they're munching away. And they're basically being idle.
So we'll set the scene. We've got a young girl called Eve who is a type 1 diabetic. She's had it out her life. She's got a best friend, Jess, who she confides in. She talks to her about everything. She's fully compliant on type 1, what to do for her. And we're sat in the school right now having lunch and chatting about all of our past and lots of history, because we've been friends for ages.
Yes.
So I've just got to go inject, so I'm just going to pop to the loo if that's alright.
I'll see you in a bit.
Recently over Christmas, one lad put himself in hospital because he went 5 days on a bender, drinking cider, eating what he liked. It was Christmas. He was close to death. He was hospitalised, and I think it took him to that point to realise, oh, actually, this is real. This isn't just make believe. This my friend, and then his friends found out, and they're like, "You've got what? You've got type 1 diabetes."
What did you say?
Yeah.
And what?
Yeah. I see the problem is getting through to the people that won't go to the groups and won't go to the help groups and won't approach their doctor about diabetes. So it's the finding out, it's asking them why they won't go to the groups, and getting the barrier, getting over that barrier, the obstacle of them not going to the groups and not being public about their type 1 diabetes. And it's breaking that barrier down and finding out the why, asking them the questions of why they won't go to the doctor, why they won't tell their friends, why they won't share it.
Today's workshop has been really invigorating, really informative and really engaging. In terms of how we engage with the public and how we raise awareness of diabetes, I think it's really important that we think very carefully about what our strategies are. So one of the first ones is that we need to think about tailoring how we take things forward with different age groups and making sure that they have a clear understanding. We also need to ensure that we're clear about what our objectives are. And I think the final thing is that we need to make sure that it's really engaging and enthusiastic for people, so that actually they remember, they engage, they get involved, and they take away what they've learned into their future lives.
There's 3.5 million people with diabetes, and there's 3.5 million ways of managing your condition. It's very dry talking about a specific aspect of diabetes. However, if you put it into a story, people can relate to that story.
I think it has to go into communities. I think we have to be a presence in communities, and that facts, figures and finger wagging may not work, but as stories, as shared experiences, and getting people to get a better understanding of what it isn't, and confronting maybe misconceptions.
The topic is so delicate when you talk about engagement of those who don't want to be engaged with their condition, here diabetes, that although we had very fruitful discussions and some of the discussions were really insightful, but still there is that big question: is there an answer to the engagement? Theoretically, I feel that we need to give every single member of the community, every single of us, a reason to invest in our health. But again, how you give it, what should that one reason be, is a long story, and I hope as time goes by the story would unfold and the truth shall reveal eventually.